Now, I might just hand everyone over to René. So I'll just quickly, before I go there, I'll just, he's also an occupational hygienist like myself. He joined environmental consulting firm in 1996, now called GHD, where he works 25 years later. He's been a corporate health and safety manager. In 2002, he completed his master's degree from Montreal University. He's a certified safety professional, registered occupational hygienist. He's also, in 2018, he joined the board of International Occupational Hygiene Association. He's actually been the president. In 2020, he was the president. He's also been my great pleasure to work with René on the board of Workplace Health Without Borders, which he really helped the organisation as well. And he's also worked with the Occupational Hygiene Training Association, and he's currently a lecturer, so congratulations on the position as lecturer at Montreal University. Over to you, René. Thank you.
Thank you very much, Kevin. So I was asked to present today with a great pleasure. Thanks, Occ, to inviting me. And I'm going to talk about my New Year's wish list. So I don't include my new electric car or my new ski. So it's just a global occupational health and safety. So here I go, and I've made my wish list. I won't make you wait any longer. I'll talk about each of them individually. But of course, I wish that in the next year we can eradicate COVID-19 and learn from it. I wish we can recognize the importance of aerosol transmission, although we heard some interesting news over the last few days. Apply occupational hygiene principles and reduction strategies. Improve collaboration between organizations. Use COVID-19 momentum to improve global occupational health and safety. And my last wish list is that Occ at work be considered as an investment and not as an expense or a privilege. So let me further detail these different items. So I went to on John Hopkins website today, and this is the latest number. It's really amazing, the number of cases, 273 million, and we can see the fatality of 5 million. And the global vaccine has been distributed at 8.6 billion. So, as you know, it's been, there's many complaints by the WHO about it's mostly been distributed in richer countries, and it's been spreaded and shared everywhere. But that's another concern. So basically, the strategy will still go, and these might be additional items. I just pointed it out. Basically, vaccination is a key to eradicate COVID. Early detection, as it was discussed earlier today, great presentation. Eventually get some immunization, and hopefully we also need to apply all the prevention, the distancing, the clean, wash your hands, and all the preventive measures, and definitely the behavior, because we saw lots of people that unfortunately still don't believe in many of these principles and are not applied. So learn from it. Why I mentioned this is that, as you all know, and I guess it has been discussed maybe in previous meeting, there's been this report, The Spring of Fear, on the SARS Commission, led by late Archie Campbell. And he explained in detail the precaution principle, and it's ironic to see that in 2006, he indicated one example was the debate during SARS over whether SARS was transmitted by a large droplet or through airborne particles. The point is not who was right and who was wrong in this debate. When it comes to worker safety in hospital, we should not be driven by the scientific dogma of yesterday or even the scientific dogma of today. We should be driven by the precautionary principle that reasonable steps to reduce risk should not await scientific certainty. So it's so true, and we never followed any of his recommendations. Well, not any, but his recommendation were basically put aside, and it's very sad that we didn't listen to this event to improve our response. And so with respect to Quebec, there's currently a Quebec National Coroner Inquiry on COVID-19 response in senior housing due to the large number of fatality. And really the priority was put in all the preventative measures were really targeted to hospital where they were really afraid of having too much cases, not being able to respond. And meanwhile, the senior housing were just the location where it hit the most. So in the last month, 20 certified occupational hygienists, we signed a document and proposed to present our point of view at this inquiry. And at the end, the coroner did not find our testimony would provide additional relevant information for the inquiry. So that's something also that was quite of a difficult conclusion for us, as since the beginning, the occupational hygienists we've tried to promote, and it's not just in Quebec, in Canada, in USA, and worldwide. I've made some pressure as well in some communication with the World Health Organization in Geneva, as I was the Iowa president, and the response and the voice of occupational hygienists is not very heard, and people are not really listening to what we could have to say. Although we have large experience and large field experience, that's basically our expertise. We are used to be on field, and the capacity for us to see the different preventative measures. So I will talk later about these proposals, but still it's hard for us to be heard, and I wish we can learn from it, and that would include getting every people and every professional organization position. And that's why I was happy as well to hear some engineers to talk, because I find that, to me, a COVID response is not just public health. It should be every people who has a scientific knowledge that can contribute, whether it's an engineer, a biologist, an epidemiologist, or occupational hygienist. All these people should have a voice to say, and it should not be limited to occupational physicians. So with all due respect, of course. So learn from it, the new reality. There's this article that was published in the Lancet in the last month that shows that there's been an increase by 53 million, or increase by 27% of major depressive disorder globally, worldwide, while there's a 25% increase in anxiety disorder globally. So this is something that is very important as well to think, and not just the COVID impact by itself, but the impact it has on the global occupational, personal and people mental health. So it's very important to discuss as well. So I'm going to go quick on that. I think it's been said before, and of course the importance of the aerosol transmission and good ventilation. And I was happy to see that there's been this decision made, and this article on yesterday in the news about the use of N95 respirator. So for us, it's about applying occupational hygiene principle and reduction strategy. So we think that, of course, there's other things that has to be done, like vaccines and detection, but this would be a place where we would impact and work on the source. So of course, we need to work on the source. We need to work and cut the arrow to for the source to not become a mode of transmission, so it would contaminate a receptor, which would therefore become itself a source. So there's a great document that was published by AIHA, and this is a new edition. It's about the role of industrial hygiene in a pandemic. So for us, it's mostly about doing job safety analysis, where of course you can have many people in the same department, but of course they're not all doing the same job, and they are not then therefore exposed to the same risk. And so that takes us to a risk matrix where you can see, depending on different tasks and what your activity, what could become the main hazard. So these are the things that we do with respect to the hierarchy of control. We all know that. Usually it's presented as a pyramid, but here I just want to indicate the importance of engineering controls, which I feel like we've been talking a lot about PPE, and even I'm not sure we were talking about PPE when we say we were talking about a procedure mask. I don't call it really a PPE. It's more of a mitigation equipment rather than a protective equipment. So it's the importance of engineering control should have been further discussed from the beginning, and that's what happened then when we saw the kids going back to school, and then the senior housing and all these places where we saw that in hospitals there was great red, yellow zones and isolation made, but in other places it was not definitely applied. And there's different type of approach that exists and that we encourage to implement. And I'm not sure that how often we see these types of a confinement, local confinement or global confinement in a department or over a patient to provide and limit the potential dispersion of contamination. And this is a tent that was presented by a physician in Quebec who said that this is something he can build within 15 minutes for a cost of $25. So, and it is plugged to an HEPA filter and with a vacuum and with the HEPA filter. And this is some kind of a confinement when you need to move a patient from a contaminated area to, let's say, a green section. Let's say he needs to do some X-ray or some other testing, and it's not in the area where he is. We need to transfer him in the elevator, in the corridor. We need to confine and prevent contamination. In Quebec, there's been a great initiative. It was all a matter of initiative because there was some global leadership, of course, but at some point it was about some local administration to say, let's do it our way. So there's this Chaudière-Appalaches region that decided for all of our staff, we're going to use PPE in yellow and red zone. And well, elastomeric mask was used for 18 months. And it's a very large district, which includes 12,000 employees, 800 physicians, 4 hospitals, and many different other infrastructures. So they decided to use this elastomeric mask, and after end of day, they had to bring it back to some kind of a structure where they would recuperate them, dismantle them, disinfect them, and reassemble them. So they had a lot of equipment, but still they didn't miss any procurement problem, and they had a great control on contamination and infection, and actually they receive a prize for their project that they've implemented in their region. So it's something that we haven't spoke much about. We've heard, in fact, many places we were basically said not to bring anything else than just a procedure mask, and it's too sad because there was other alternatives that were not spoken enough. So one of my wish lists definitely is to improve collaboration between organizations, and it's at different level, as I say here, between physicians and hygienists and safety professional and governing entity. Overall, we're all working together to improve health, whether it's public health, occupational health, or environmental health. We'll hear more and more about environmental health over the next few years with particulates in the air, with global warming. So we're all working the same effort. And that's why all these organizations has to work closer together, the UN, WHO, ICO, ILO, IOI, and all the World Federation of Public Health and World Bank, and fewer silos. So for us, the IOA, we're 36 member countries, 15 as certification team, and we're 20,000 members, but you can see we definitely need to increase our presence to better protect workers, and that's what we're doing with some of our partners. Over the next 2 months, well, we just had our conference, our international conference in Daegu, Korea well, it was virtual, but it was in October and September. And just in the upcoming months, in February, there's the ICO conference. And in May, there's the Vision Zero Japan conference that are both going to be virtual. So use COVID momentum to improve global occupational health and safety. I just want to mention that never before global worldwide population has reached this level of awareness on prevention and protection. So we must use this momentum to improve global occupational health and safety. Just to mention, there's 2 million OHS fatality per year, not including COVID, 1.6 from occupational illnesses, 0.4 from workplace. Of course, you know that there's 10 times more workplace accident than occupational illnesses, but there's 5 times more fatality related to illnesses compared to accident. And just to mention, tuberculosis at 1.8 fatality per year. So we must use this momentum. Occ at Work is an investment, so not an expense. And just to mention that these are old numbers, but it's still thought to be relevant. The overall occupational health and safety represents 4% of the global gross domestic product, so of worldwide. So it's amazing the cost it corresponds. And if it was put as an investment and not as an expense, we could really save lots of money and productivity, and not talking about the impact on social life and on human itself. So there are some international conventions, ratification from the ILO, and just to mention that there's 102 countries that have signed none of them. So these countries, of course, they don't have the proper infrastructure with respect to occupational health and safety, and of course it impacts the response on COVID. So I wish there was better communication and opportunities for countries to work together. And just a final thought, this was a RG3, risk group 3 biological hazard. What if a RG4? This being said, thanks to all, and I hope you appreciated my short presentation. And this is my LinkedIn connection. You can reach me, and we can further discuss if you are interested. Thank you very much, Kevin. Thanks, Occ, and happy holidays.